My name is Kim Kaluger. This is task 20, post-operative care suture or surgical staple removal. So after a patient has recovered, the incision from the surgery needs to be inspected and to ensure that the area has completely healed. For a normal, not too invasive surgery, like 7 to 10 to 14 days is what the average would be on the suture removal. Most incisions are closed using several layers. The deep tissue layers, and then there's a subcutaneous layer, and then there's the outer layer to bring the edges of the skin together. And they'll use absorbable down underneath, and then on top, a lot of those times the sutures will need to be removed. What you want to look for when the patient comes back in to make sure that the incision has actually healed well, you want to make sure that there's no loosening of the sutures, or that there's sutures that have fallen out or are missing. If the patient has been excessively licking or chewing the area, the pet should definitely go home with an Elizabethan collar. We have several different kinds of Elizabethan collars. We've got the hard plastic one, we've got a soft collar, and then there are the inner tube type e-collars as well. And sometimes patients or clients will bring their own e-collar with them. You're also going to look for any swelling at the incision site, which can indicate infection or a reaction to the suture material. You're going to look for discharge or any bleeding from the incision. It's normal to have some seepage for like 24 hours after surgery, but after that we would want to see them back. Also, what it should look like, it should be a clean, the edges should be touching each other. Skin can range from like a slightly pink to normal color, maybe even a little bit reddish a few days after surgery as it begins to heal. Sometimes the client will see a little bit of bruising around the surgical site, which is from blood seepage underneath the skin edges. Fresh incision sites may seep, like I said, a little bit up to 24 hours post-surgery. You want to make sure that there is no tissue or flesh coming through where this incision site is. It's called wound dehiscence, and I have printed out a picture of what that looks like right here. And you can see that here are the sutures, and this is where it has come open, and that's called dehiscence. I also printed out a picture of a normal what it looks like. Normally you can see the umbilicus right here, you can see the umbilicus, and then this is the actual suture incision site, and these are what it looks like with a normal healing process. I also have a pair here of little suture scissors. These are tiny ones for little small patients. We use these for cats, sometimes bunnies, smaller animals, and they have like a little hook underneath to go under and grab the suture material and clip it. If I was doing this on a live patient, what I would be doing is visualize the incision site, let the veterinarian know how the incision site looks. If there are any issues with the incision site, then I would use my suture scissors to clip. Also would look in the chart, because the doctor will write how many sutures need to be removed, and then make sure that I'm not harming the patient in the process of clipping the sutures. And that's it. Basically, you want to make sure that there is no abnormal swelling, no seepage, no that the incision's not coming apart, and that is it.